Hi, everyone. For those that don't know me, my name is Jessica. I'm the CIT training coordinator at Crisis Services. First, I want to thank everyone for the work they're doing during this pandemic. After talking to some departments and doing some research, mental health and suicidal thoughts seem to be increasing in some individuals. We'll be doing a quick overview of suicide prevention and assessment. This 5-minute training is based on the CIT training we deliver, however, it just covers the basics. If you'd like any more information, my contact information is at the end of this presentation. We will be covering warning signs, risk and protective factors, what to do if you come across someone who is suicidal, and resources available if the person does not meet 941 criteria. Depression can be a big indicator of suicide. 2/3 of people who complete suicide experience depression at the time of their death. The risk of suicide is 25 times greater in people with major depressive disorder than the general population. Major depressive disorder affects more than 16.1 million American adults. If left untreated, depression can lead to other problems such as alcohol and substance abuse and higher rates of suicide. Along with depression, other mental health disorders such as schizophrenia, borderline personality disorder, substance abuse, and conduct disorder in children are also at increased risk. Males are at higher risk of suicide than women, and if anyone has attempted suicide before, they have a higher rate of attempting again. Just because someone has these risk factors does not mean they will complete suicide. It's just something to keep in mind when assessing an individual. One big thing to remember is asking a depressed person if they're suicidal does not give them the idea or push them towards suicide. So please don't be afraid to ask people questions about suicide. When talking to an individual about suicide, pay attention to some warning signs that something may be wrong. What kinds of statements has the person been making? Have they been talking about suicide? Do they have a plan? Have they been seeking out means to kill themselves, like getting a gun, going to buy rope? Have they stocked up on pills? Has their substance use increased recently? Are they hopeless or helpless and feel like they have no future? Have family or friends reported dramatic mood change? Are they usually happy but have started to seem sad or angry? Are they usually sad but have recently seemed very happy? Either one can indicate someone has suicidal thoughts but is keeping it to themselves. Recent impulsive behavior is also a warning sign. If someone cannot visualize themselves in the future and cannot identify something they are looking forward to, it also could be a warning sign. Protective and risk factors can be used as a guide to assessing how likely it is someone will attempt suicide. These are just some of the risks and protective factors they can come across, but it'll give you a jumping off point. Some risk factors include prior suicide attempts, like we've said before, access to lethal means. Does the person have a gun in the home? Do they have access to pills? Substance abuse, mood disorders, and self-injurious behavior. Cutting and self-harm does not always mean someone is suicidal. Some people who are cutting use it to cope and have no suicidal intention behind it. So making sure that you distinguish whether they are cutting to cope or because they want to kill themselves. Protective factors can help someone overcome suicidal thoughts. Protective factors include an individual's ability to cope with the situation, the resiliency of a person, availability of mental health treatment, or if they are in treatment currently, or if they're willing to get treatment, strong support of family and friends, if they're future oriented, and they are able to identify a reason for living. Pets can also be a big protective factor, especially during the stay-at-home order because people may be separated from family, but they will be at home with their pets. COVID-19 causes a unique set of risk factors for people that can contribute to increased depression and suicidal thoughts. Some people have lost their jobs and are going through an economic hardship. There's also lots of fear and worry of the unknown and about loved ones. People may be experiencing increased anxiety due to those things, which could cause an increase in depression and suicidal thoughts. People are also experiencing changes in sleep and eating patterns, maybe increased use of substances such as alcohol, tobacco, other drugs. And lots of people are cut off from their support systems and are isolated in their homes. And without those support systems, it may be hard for them to cope with what's going on. When assessing for suicide, go through the following questions. If you do not feel comfortable at any point in assessing someone, you can always call Crisis Services for mobile outreach. First question is asking someone about suicidal thoughts. Always ask, are you thinking of killing yourself? Never are you going to hurt yourself. Hurting yourself and killing yourself are two completely different things. Someone may want to hurt themselves by cutting, but don't want to kill themselves. Other people want to kill themselves, and if you ask them if they want to hurt themselves, they may say no. The next question is, have you thought of a plan of how you would kill yourself? If someone has thought of a plan, explore if the person has any means available to carry out that plan. Do they have a gun? Do they have access to knives? Do they have pill, ropes, any kind of fluids? Things that they could use to carry out that plan. The next question is, how long have they been thinking about acting on these thoughts? Has it just been the day? Has it been years? How likely are they to act on the thoughts? The longer they have the thoughts, the more the increase in risk that they will try to complete suicide. Before leaving someone, it can be helpful to create a basic safety plan. Does the individual have supports they can call? Do they have any coping skills they can do when they have those thoughts come up? Can they identify any triggers and avoid them? For example, if they're living with someone who triggers them, can they leave the room, go for a walk? If they have a gun or pills in the house, can they create a safety plan to get rid of them or have someone hold on to them? Keep plans realistic. Obviously, if someone says their coping skill is to go to their gym and all the gyms are closed right now, it's probably not a good safety plan. Most of all, trust your gut. You know what you're doing. Some things to remember. Use empathetic statements such as, you are going through a lot right now. Some people in similar situations have thought about suicide. Have you thought about killing yourself? Always ask about suicide twice. If someone refuses to disclose a plan or you're in doubt about the situation, please consult a mental health professional. After you assess someone, there are a few options you can do. You can always 941 someone to ECMC, leave them in the community, or you can call Crisis Services Mobile Outreach. Mobile Outreach can provide lethality assessments over the phone with the person. They can do it while you're on site or even after you leave. They can also do a visit with the person, and even during these trying times, Outreach still provides mental health evaluations. Outreach can also provide follow-up and linkage to counseling after you leave the individual. To reach Crisis Services for any lethality or mental health concerns, please call 716-834-3131. I also included my email and work cell number to answer any questions you may have. Thank you for sitting through my mini presentations. These will be provided to your department every week. Stay safe and stay healthy.